Hello viewers, today's topic is regarding vitamin D and its relation to infertility and the treatment of vitamin D deficiency. This is a part 2. Part 1 of vitamin D I have already done earlier, you can go and see that. This is a part 2 version, the last version. So in this episode I am going to discuss about how vitamin D can cause infertility problems for both men and women, and the treatment of this vitamin D deficiency. What are the treatment options which are available, how best can you treat vitamin D and get over this problem and lead a happy and a healthy life. So vitamin D in women can lead to PCOD, polycystic ovarian disease. There is one problem called polycystic ovarian disease. Many of you would have heard of this problem. The periods will be irregular, the women will be having weight gain, they'll be having hair growth in their body, facial hair growth, and they may not become pregnant on time and things like that. So these are some problems with PCOD. Suppose vitamin D is deficient, then it can lead to PCOD. That is one reason. The second thing is, if vitamin D is deficient, then the ovulation may not occur properly at the correct time. So that is called anovulatory cycle, or anovulation can occur because of vitamin D deficiency. The ovulation may not occur properly because of vitamin D deficiency. Usually the ovulation will occur somewhere between day 8 and day 14 or something like that. So if this vitamin D deficiency is there, the periods are going to become irregular and the ovulation also is not going to happen properly. So because of that, eventually it can lead to infertility problems. So vitamin D has a role in PCOD and anovulation. As I already told in the previous episode, vitamin D has a relation with insulin resistance. The more insulin resistance is there, the more infertile is going to be a person, be it man or a woman. It's going to definitely have an impact on the human body. So vitamin D is linked with insulin resistance. Vitamin D deficiency is linked with insulin resistance. So vitamin D deficiency should be corrected to reduce the insulin resistance and in turn to reduce all other complications because of this insulin resistance. Suppose your vitamin D is deficient and you're doing some IVF procedure, then your vitamin D deficiency can actually have an impact on your IVF procedures. You may not get pregnant properly, you may not get pregnant positively because of this vitamin D deficiency. So it has a role or effect on IVF procedures and the problems because of that. And even this vitamin D, it's told that it can cause endometriosis and even fibroid. Most of them will be having fibroid in the uterus. So this vitamin D has some anti-inflammatory property. Probably it can reduce the growth of fibroid. Suppose the fibroid is there in the human body and the person is also having vitamin D deficiency. So this vitamin D deficiency will not cannot do its anti-proliferative effect in the body. So it can lead to growth of the fibroid, and that can lead to more bleeding and more infertility problems, and even endometriosis can happen, and eventually it's going to lead to infertility. So these are the problems which are concerned with female infertility, and this vitamin D deficiency is linked with obesity, insulin resistance. I already told you that. So it's all kind of an interlinked issue. This is one part of the female part. The next comes is, how is it related to a man? Vitamin D, as I already told you, has some insulin resistance. So insulin resistance, if it's going to happen in man, then also it's going to bother him. It's going to impact his sexual ability and the quality of the sperms and things like that. So vitamin D directly has an effect on the sperm motility. We need good number of sperm motility for reproduction to happen. So if the sperm motility is going to be less or it's going to be inadequate, then there is less chance of pregnancy. Suppose vitamin D is deficient, then it is going to lead to low sperm motility. So that is eventually going to lead to male infertility. The other thing is, it can also, vitamin D deficiency can also lead to low hormone level, testosterone hormone. Male sex hormone is called testosterone. So this testosterone hormone in the body can also come down because of vitamin D deficiency. The another concept is, the vitamin D can also lead deficiency can also hamper the acrosome reaction. That is something involved with the sperm, that is called an acrosome reaction. It can also lead to this problem with the acrosome reaction. So in these ways, the female infertility as well as the male infertility can be affected because of vitamin D deficiency. So in the previous episode I have told you the other problems of vitamin D deficiency, the general problems not relating to infertility but the other general problems. So in general, if a person is having vitamin D deficiency, how can we treat it or how can we come over it? This vitamin D deficiency is available as solution in nano forms. It is called microparticles, nanoparticle it is called in nano form. One is in solution, the other is as capsules, okay, so as tablet form, as orally we can take. So this vitamin D, if you are having deficiency or insufficiency, we need to take 60,000 units of vitamin, 60k we will say, 60k international units of vitamin D3 you will take, the active form, cholecalciferol is the name. So once a week we will take for 8 weeks, roughly for 2 months we will be taking this vitamin D weekly once. After that 2 months we will be taking this vitamin D once in a month for the next 3 months. Okay, so totally almost 5 to 6 months of treatment is necessary to overcome this vitamin D deficiency or insufficiency. The other concept is that daily you can take 1000 to 2000 units of vitamin D3. That is also another option. You can take it as a vitamin D supplement every day. If you don't want to take it weekly or monthly, you can take it every day for almost say 4 to 5 months almost, you can take that also. That is also one option which you can do. The other thing which you can do is, there is one option called a depot preparation that comes in the injection form. That is a one-time dose, that's all. One-time dose you will be taking, and you can take even up to 6 lakhs. It depends on the body weight. We calculate it based on the body weight. Every person will be having a different requirement. So based on that we will give a one-time dose, and that's the effect of that can last even up to 4 months. So just a single shot can help you come over your vitamin D deficiency for the next 4 months. So after that, what are we going to do? That is something very important. One time you are finding you are having vitamin D deficiency, you are treating it, your treatment is over. After that you are going to stop taking the vitamin D. So after that, to avoid getting vitamin D deficiency again, what are we going to do? One thing, as I already told in the previous episode, sunlight exposure. Adequate sunlight exposure is needed. The other thing is by taking vitamin D through food sources. I already told the food sources which can be taken for vitamin D. The other thing is by avoiding unwanted sunscreens or closing our full body and things like that. Extra protection from sunlight, avoiding that extra protection or coverage from sunlight. All these can help us to maintain our vitamin D levels sufficiently in normal quantities without taking medications after treat the vitamin D deficiency. Suppose in spite of doing all this, we are not able to get over this vitamin D deficiency, then there is some therapy called light therapy, that is with ultraviolet B radiation. It's called ultraviolet B light therapy. If we are using this light therapy, then we can get over this vitamin D deficiency. This vitamin D requirement is different across different ages. For example, for a child age less than 1 year, that child requires almost around 400 units of vitamin D per day. That's why you can see a newborn, once a delivery is happening, most of the doctors will be giving them vitamin D as drops, because the mother's breast milk is not having enough number of vitamin D. The child may not be exposed enough to sunlight every day, so that child requires some kind of vitamin D supplementation to have the normal metabolism in the body and functioning. So 400 units of vitamin D per day is necessary for a child, maybe even up to 1 year. So after 1 year up to 18 years, we need almost around 600 to 800 units of vitamin D per day. After 18 years, we require around 2000 units of vitamin D3 per day. So in this video, I have covered how is vitamin D related to infertility, what are the treatment options for vitamin D3 available, and what is the daily requirement of vitamin D needed across all the ages. I hope this video was helpful to you. Please click on the like button if you like this video, and do share our videos with your friends and family members. Do not forget to subscribe to our channel and click on the notification all button for regular updates. Stay healthy. God bless you.